Yes, good evening all of you. Good evening to the virtual platform of B-GHUD OET. I hope all are doing good and fine. Here it's me, Abhilash Vijay Mohanan Nair, the Senior Faculty OET Speaking. So once again I welcome you all onto this virtual platform. ഇപ്പോൾ എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നു, സമാധാനമായിട്ടിരിക്കുന്നു, സുഖമായിട്ടിരിക്കുന്നു എന്ന് വിചാരിക്കുന്നു, ഹെൽത്തി ആയിട്ടിരിക്കുന്നു എന്ന് വിചാരിക്കുന്നു. So as usual, my dear Bonnie has sent me a message like, hi sir, good evening, good evening, good evening, good evening, good evening Maklai, all of you good evening. So those who are watching me, I welcome you once again. അപ്പോൾ നമ്മൾ this is our 12th virtual platform presentation. അപ്പോൾ നിങ്ങളുടെ എല്ലാവരുടെയും കണ്ടിന്യൂസ് ആയിട്ടുള്ള റിക്വസ്റ്റ് കാരണം നമ്മളിപ്പോൾ 12ാമത്തെ virtual platform സെഷനുമായിട്ട് മുമ്പോട്ട് പോവുകയാണ്. വി ആർ ഗെറ്റിംഗ് സച്ച് എ ഗുഡ് ഫീഡ്ബാക്സ് ഫ്രം ഡിഫറെൻറ്റ് പാർട്സ് ഓഫ് വേൾഡ് ഓവർ ദ വേൾഡ്. ഓക്കെ, ലൈക്ക് wherever this aspirants are there, our students are there, they all are sending me good messages to our B-GHUD platform, good messages like they are really feeling use of these sessions. So I always ask my dear students to send me questions, their concerns, queries related to occupational English test assessment examinations. Now I'm dealing with speaking module, and of course you'll be having sessions on Fridays with Salsar Shali ma'am, so you could make use of all these sessions to fetch a very good score in your OET, Occupational English Test Examination. So by next year this time you could fetch a good score and can move to your dream destinations. ഓക്കെ, അപ്പം എല്ലാവർക്കും നമ്മൾ 12th സെഷനാണ് ഇപ്പോൾ പോകാൻ പോകുന്നത്. നമുക്ക് സ്റ്റുഡൻസിൽ നിന്നെല്ലാം നല്ല ഫീഡ്ബാക്കുകൾ വന്നുകൊണ്ടിരിക്കുകയാണ്. ക്വയറീസ് കൺസേൺസും ഒക്കെ ധാരാളമായിട്ട് വരുന്നുണ്ട്. ക്വസ്റ്റ്യൻസ് അയച്ചു തരുന്നുണ്ട്, അതുപോലെ തന്നെ കൺസേൺസ് അയച്ചു തരുന്നുണ്ട്. അപ്പോൾ നമ്മളതെല്ലാം നമ്മൾ എന്ത് ചെയ്യുന്നുണ്ട്, ഡീൽ ചെയ്യുന്നുണ്ട്. അപ്പോൾ നിങ്ങളെല്ലാവരും ശ്രദ്ധിക്കുക. ഐ ജസ്റ്റ് വോണ്ട് ഓൾ മൈ ഡിയർ സ്റ്റുഡൻസ് ടു സപ്പോർട്ട് us like this. Okay, always your interaction will make us more and more strong. Even I would like to tell you there's a critical appraisal. I always welcome that. Okay, ഒരു critical appraisal ആണെങ്കിലും you could send us if you feel like some sort of improvement from our side. I always appreciate that. We always welcome that. We could always appreciate that because our students are our strength. So we salute for your continuous support and all your guidance, the sort of guidance that you are giving us. Okay, അപ്പോൾ നമ്മൾ എന്താണ് പിന്നെയും നമ്മൾ ടോപ്പിക്കിലേക്ക് കടക്കും. അതിന് മുമ്പ് നമുക്ക് ഡൗട്ട്സും മറ്റു കാര്യങ്ങളും ഒക്കെ വന്നിട്ടുണ്ട്. ഹോപ്പ് ഓൾ ദോസ് പ്രീവിയസ് സെഷൻസ് വെർ വെരി യൂസ്ഫുൾ. ഐ വോണ്ട് ഓൾ മൈ ഡിയർ സ്റ്റുഡൻസ്, ഓൾ മൈ ഡിയർ ആസ്പിറൻറ്റ്സ് ടു വാച്ച് ദിസ്, ലൈക്ക് ദിസ്, കമൻറ്റ് ദിസ്, ആൻഡ് ഐ വോണ്ട് above all I want all of you to share this. Okay, please share it among those who are needy, those who wish to cherish their occupational English test examination, those who wish to cherish their dream of moving abroad, especially English speaking countries. Okay, അപ്പോൾ so now opportunities are plenty. അവസരങ്ങൾ ധാരാളമാണ്. only thing എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ നല്ല രീതിയിൽ ലാംഗ്വേജ് കോച്ചിങ് എടുക്കുക, അതേപോലെ എന്താണ് ടെസ്റ്റ് എഴുതുക, എക്സ്പീരിയൻസ് എടുക്കുക, നിങ്ങൾ പോവുക, ഗെറ്റ് settled well. Okay, ഇപ്പോൾ എല്ലാവരും സന്തോഷമായിട്ടും സമാധാനമായിട്ടും സെറ്റിൽ ആകുക. സോ ലെറ്റ് മീ താങ്ക് ഓൾ. ഹായ് മനെ കാർത്തിക, ഗുഡ് ഈവനിങ്, ഗുഡ് ഈവനിങ്. യെസ്, so before that I would like to thank to all my gang members, all my dear members, those who are supporting me in making this session possible. So always I should do that. It is an obligation of mine to thank to all my dear colleagues, my dear friends like Ajisam, Vipin Vasudev, Jobin, and my dear Abhi for making this session possible. Joyce and Rohit all are there with me for making this session possible. So I would like to thank on behalf of all of you to make this session possible. Every time I'm just saying like this, I'm just taking these lectures. That is what only I could do. Okay, but this technical support is given by all my dear members. So salute to all my dear colleagues, my dear friends, my dear Pillar for their support. Okay, so നമുക്കപ്പം നമ്മുടെ സെഷനിലേക്ക് കടക്കാം. വി ഡോണ്ട് വാണ്ട് ടു വേസ്റ്റ് ടൈം. ഓക്കെ, സോ ഇന്ന് നമുക്കൊരു ക്വയറി വന്നിരിക്കുന്നതെന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ സർ യു ക്യാൻ ജസ്റ്റ് ഓഫർ സം ടിപ്സ് ഫോർ സ്പീക്കിംഗ് ടെസ്റ്റ്. ഓക്കെ, എന്തെങ്കിലും ടിപ്സ് തരാമോ എന്നുള്ളതാണ് നമ്മുടെ ഇന്നത്തെ ആദ്യത്തെ ക്വയറി വന്നിരിക്കുന്നത്. ഈ ടിപ്സ് എന്നൊക്കെ പറഞ്ഞു കഴിഞ്ഞാൽ നമ്മുടെ ഫസ്റ്റ് ക്ലാസ്സിൽ തന്നെ ഓൾമോസ്റ്റ് ഓൾ ദോസ് ടിപ്സ് വി ആർ ഗിവൺ ടു യു. ഹൗ ടു ഗോ ഫോർ ഇംഗ്ലീഷ് OET, occupational English test speaking. Okay, so all those tips we are given. So again I would like to tell you some more things. So there are so many students, those who couldn't attend all those sessions, but you could watch. All those feeds are there. You could go and have a watch on those sessions. If you have enough time, please go and watch those sessions. For sending, okay, these queries, I would like to extend you some sort of advice, some tips I could offer you now. Okay, അപ്പോൾ നിങ്ങൾക്ക് യൂസ്ഫുൾ ആയിട്ടുള്ള ചില ടിപ്സ് ഞാനിപ്പോൾ തരാം. So when it comes to occupational English test, there are some important things that you need to mind during your test. Whenever you are giving your test, there are something, okay, some important tips I could give you. Like, so first and foremost thing, whenever you go for this examination, you want to know the basic structure. I always say like 20 minutes, 2 role plays. Okay, all those things are there. So the first and foremost thing that you need to notice when it comes to occupational English test speaking is like question, appraising question, or assessing question, reading question in a proper format, assessing the format, understanding the format of this question, how it is designed, how it has been designed, and how it has been asked, all those things. Okay, critical appraisal of question is the stepping stone to success when it comes to occupational English test speaking. Critical appraisal means you need to read it from top to bottom. 3 minutes. Make fine and fair usage of that entire 3 minutes. Read from top to bottom. All those things. You need to notice what the setting is. You need to notice the scenario, how it has scenario in the sense, the working description, that descriptive things that is given on behalf of that nurse. Okay, that working scenario, then its explanation for that scenario that will be there, and this task means where, what, and where, how, and what. Okay, that is what. So you need to everyday in that is what the structure says. You need to focus on that place, setting where the role play takes place. You need to see how the scenario has been described and see what the task is to be, the task which has to be satisfied. Okay, so critical appraisal of the question is the first thing. Read the question properly, the 3 minutes, instead of asking for that names and all. Before that, make sure that you are understanding the question carefully, properly. That is the first and foremost, the most important tip that I could give you before moving into your examination. Critical appraisal of the question, assess the question properly. And next is like, okay, Mane, so hello, many are sending me messages. Okay, whenever you are explaining something, okay, so you could say, like, you could imagine like interlocutor would be there. Actually, the role play, this is a role play, and your voice is recorded. Okay, your voice is recorded, not your gestures and all. Always we ask you to speak in by using this actions, reactions and all, means that would modulate your tone. Okay, that you can speak more fluently and more naturally you can. Okay, so this voice is recorded. So if you use proper gestures, actions and reactions, means definitely that could obviously, that automatically that could modulate your tone, and it will give a natural format of speaking. Okay, just like not just like some by-hearted version, it would be just like something which is very natural. Are you getting me? So make sure that this, okay, understand that this voice is only recorded, okay, as we are invisible to the examiner. Interlocutor would be there to make this, carry out this role play, but actually the examiner is invisible to us. Okay, yes, and be descriptive. So that is another thing that you need to focus. Be descriptive in the sense, whenever you are discussing some, if it is given like myocardial infarction, or it is given like Whipple's procedure, some complex terms, make sure that you are simplifying all those things. Mr. Martin, you are having myocardial infarction. Can you say like that? By that moment itself, the patient will get his clearance towards that other world. Okay, so never make the patient panic or afraid by saying all these complex words. Be descriptive for each and every, whenever you are describing some procedure or whenever you are giving some explanation about some disease condition, make sure that your people are describing it properly, that too in a simple and well understanding manner. You need to explain that. Okay, never go for any complex medical terms. Even if it is given, some complex medical term is given, you need to simplify that in the best possible way where the patient could understand. Okay, so if it is given like myocardial infarction, well, Mr. Martin, the diagnosis is myocardial infarction, it is otherwise called as heart attack. Okay, you relax the way by which you could. Okay, so if it is Whipple's procedure, means it is surgery that is actually done to your pancreas to remove the cancerous cells. So likewise, you can simplify the thing and you can go for that. Okay, and I want all of you to focus on your speaking fluency. Okay, that is the best part. Always you should remember, make sure that you're doing on that fluency, you're focusing on that fluency, not your knowledge is assessed. Okay, not your knowledge is assessed. So that is what you need to take a great care. It is not for assessing your knowledge. There is no need for cracking something. You need to consider that opposite person, interlocutor, as a common folk, as a common person. You wouldn't be able to understand all those complex medical terms and all. Okay, സാധാരണക്കാരനായിട്ടുള്ള ഒരു വ്യക്തിയാണ്, അവരുടെ അടുത്ത് ചെന്നിട്ട് ഇപ്പം നമ്മൾ വലിയ വലിയ ഹാർഡ് ടേംസ് ഒക്കെ പറഞ്ഞു കഴിഞ്ഞാൽ ഇറ്റ് വിൽ ബി വെരി ഡിഫിക്കൽട്ട് ഫോർ ദം ടു ഫോളോ. സോ instead of expressing your knowledge, always try to focus on your speaking. So whenever you offer some good morning, your wish, gratitude expression, make sure that the patient feels that good morning Martin. Okay, so if you say that good morning, that pleasant should be there, and even the patient could obviously return a reply like good morning Nas. Likewise it should be, not like good morning Martin, I am Abhilash in that business. Never go for all those things. Okay, make sure that it is a speaking fluency test. Try to modulate your voice. Intonation is what speaking is. Okay, so it is not your knowledge. And in case knowledge, in the sense, I cannot say like always knowledge is not assessed. Knowledge is a part. Okay, but in case if you don't know some diagnosis, if you are not aware of some procedures, you could hypothesize. Okay, you could hypothesize it and you can tell. Hypothesis in the sense, even if you don't know something like that, you can just give an educated guess. Educated guess in the sense, which is something which is a factual guess, a reasonable or a genuine guess. Excuse me. So make sure that you are just giving an educated guess. Okay, never go for any false reassurances, never go for any false terms, never give something which is foolish. Okay, an educated, a reasonable, a factual guess you can give. Yes, so yes, അപ്പോൾ നമ്മൾ എന്ത് ചെയ്യണം? We need to make sure that we are giving an educated guess. Okay, factual guess we could give in case if we are not aware of that disease condition or that condition or procedure or whatever, if it is not known to us. Okay, അപ്പോൾ നമുക്ക് ഏതെങ്കിലും കാര്യങ്ങൾ നമുക്ക് അറിയത്തില്ല എങ്കിൽ ഒരു ഫാക്ച്വൽ ഗസ് നമുക്ക് കൊടുക്കാം. ഹോപ്പ് ഓൾ ആർ ഫോളോയിങ് മീ. So please do support me with your emojis, your comments and your thumbs up, all those things you could give me to support me, to encourage me. Okay, I always welcome all those things. Okay, I can see some sort of numbness from my candidate side. Okay, so so and the next one is like make sure that you are speaking slowly and clearly. Okay, slowly in the sense the pace should be moderate. Never go for extreme slowness. No, that could affect with your time management. So if you are using a moderate pace, a slow clear pace, if you maintain, means you can definitely stretch out the time. Okay, that is the most important thing. Hi Jayalakshmi, good evening. So if you go for a clear and slow speech, means that could help you to stretch out your time. You can give elaborations, you can minimize the amount of mistakes, all those things that you can do. Okay, and you could even dilute some sort of thick accents. If sort of some thick accents come, means you can dilute that thick accents. Okay, some thing which is very hard to follow, that I have already told you that you could elaborate some hard things in a simple and understanding manner, all those things that you can if you go for if you speak slowly and clearly. Okay, that mostly it helps you to stretch out your time. Okay, that the amount of mistakes will be reduced and you will gain a sort of confidence when it comes to that. Yes, all my dear students, I hope you all are following me. Yes, okay. So now I think I have just given you all those sorts of guess, so some sort of tips. So these are some useful tips that you could always remember for before you attend your examination while going for an attempt in giving OET examination. So now it's time for us to move into our topic, and this topic was sent to me by some of our students actually, and they requested me to go for the presentation. So we'll go for that. Jovin, please display the question. So I'll be giving you a few time for you to see the question, understand the question properly. After that, we'll go for discussion. Okay, so now let's have a quick look and assessment of our question. So the setting is emergency department of a large city hospital. So the hospital condition is also described just like a emergency department. It is a large city hospital. A 32-year-old vehicle accident victim, the driver of the vehicle, has been brought to emergency suffering a suspected broken arm and concussion from the accident. The patient also appears moderately drunk. It is midnight on a Saturday night, and the ward doctors are very busy attending to many other patients, including victims of vehicle accidents, bashings, and drug overdoses. You are trying to assess the patient's injury before further treatment. Okay. See, this is an emergency department, and a huge sort of background information has been given, like this 32-year-old man, that too the driver of a vehicle, suffering concussion, and so we suspect a concussion and broken arm following an accident. This patient was brought to emergency casualty following an accident. He was driving the vehicle. Okay, it seems the patient is moderately drunk. Okay, appears that through his gestures, actions, the patient appears moderately drunk. It is midnight on Saturday night. Midnight in the sense almost it is nearing a Sunday morning. Okay, and the ward doctors are very busy. Okay. So it is a large city hospital, so you could expect many other sort of patients, because vehicle accident patients where there bashings, okay, some sort of struggles, drug overdoses are there. Now we are trying to assess the patient's injury before further treatment. So the patient has been brought to the unit. Our duty is to assess the injury and his status, okay, before further treatment. Yes, ask the patient what he remembers about the accident. So okay, so we need to ask what about the accident. We need to collect some information. Tell the patient that you have no information about other passengers in the car, that the most important thing for now is vital signs to be checked and to be made comfortable while waiting for a doctor. So the patient would be asking about his friends. It is given like in the car there were other people, other friends of him too. So when he asks, now we need to make him aware that we don't have any information. Now our priority is to deal with the patient and also to make him all right before the doctor comes. All right in the sense we need to carry out vital signs and all other investigations or assessments before the doctor comes. Okay. Refuse the patient the use of phone asked for. So the patient would be asking for his mobile phone, but we need to refuse it politely. We need to explain the things. Okay. It is missing. Deal with the patient's other concerns while encouraging to be positive and to relax, be sympathetic but firm. Okay. So the patient would be expressing some other sort of concerns, but we need to be, we can be sympathetic, but a firm sort of decision should be explained and expressed. Okay. We can be sympathetic, but we cannot cry with the patient. Okay. We have to give a firm suggestions. We have to be very firm because the patient would be expressing. Let us see what are all the concerns of the patient. So let us see that during our conversation. So whenever the patient expresses some other concern, we can be sympathetic, but make sure that all your decisions are firm and you are very adamant. You are an exacting taskmaster. Okay, never go for we cannot. There are certain some wish we cannot go for satisfying. Okay, we cannot satisfy. So make sure that here we are making him positive, make him relax, encourage him. All those things we can do, but make sure that you are sympathetic and firm. That means assertive, ability to say yes or no politely and firm. Okay, and frankly. Give the patient some encouraging words to end the conversation as you prepare to take vital signs. So finally, we need to end up the conversation by making the patient relax, encouraging him, making him more positive, and before taking this vital sign. So that is what always this most of the tasks are here to make the patient positive, make him optimistic, make him encourage him, okay, or some sort of appreciation should be given him to make him stable. That is what the entire topic is. Okay, so the so the question will be displayed once in a while. You can have a look onto that, all my dear students. I hope all are following. So the obvious concern of my students were they were like can they go for some sort of wishes and all those things. So it is given like a large city hospital. The patient has been brought following an accident. So you can take it as an unknown way, in an unknown manner also you could say. But for exam point of view, I ask you now I strongly request you to go for asking. You can collect the name and can start the conversation. Okay, so patient is here, somehow we have collected his name. So with that name you can confidently you can move, otherwise there will be some sort of you'll be very inferior and shy, you'll be losing your confidence. Okay, instead to avoid that you can start it by asking name. Okay, and good morning, good afternoon and all is not appreciated here because the patient is here following a crisis, an accident. So in an emergency situation, in an emergency room, you can imagine yourself as a nurse how you will be carrying out an emergency patient who has been arriving in a casualty following an emergency. So the patient is there. So we cannot, it's not fair to start with good morning, good afternoon, good evening. So we can just start the conversation in a more natural way that I will show you. Okay, it's not fair to start just like good morning. So there is no need, even if you don't go for good morning and in self-introduction and all, it is not a must in the beginning. Instead, we need to deal with the patient more effectively so that we could grasp his attention towards us. Okay, നമ്മൾ എന്താണെങ്കിലും ഒരു ഗുഡ് മോർണിംഗ് ഗുഡ് ആഫ്റ്റർനൂൺ ഒന്നും പറയാൻ പറ്റുന്ന ഒരു സിറ്റുവേഷൻ അല്ല, എമർജൻസി ഒരു കാഷ്വാലിറ്റി ഫോളോ ചെയ്തിട്ട് വന്നിട്ടുള്ള ആൾ, അവരെ നമ്മൾക്ക് കോൺഫിഡൻസ് ഗെയിൻ ചെയ്യത്തക്ക രീതിയിൽ നമ്മൾ എന്ത് ചെയ്യണം, അവരുടെ അറ്റൻഷൻ ഗ്രാസ്പ് ചെയ്യത്തക്ക രീതിയിൽ നമ്മൾ ഡയലോഗ്സ് പാസ് ചെയ്യണം. ഓക്കെ, സെൽഫ് ഇൻട്രൊഡക്ഷനും മറ്റു കാര്യങ്ങളും ഒന്നും ഇതിനകത്ത് ആ ഒരു എമർജിങ് ഫേസിൽ നമുക്ക് ചോദിക്കേണ്ട ആവശ്യമില്ല. ഓക്കെ, സോ ബട്ട് ഐ വിൽ മേക്ക് യു ലേൺ how we can take this role play in an effective manner. Even if it is an unknown, like you can go for that, but it takes needs much more confidence. Okay, so now I will make you learn both of those ways. I could explain you. ഞാൻ രണ്ട് വശവും നിങ്ങൾക്ക് പറഞ്ഞു തരാം. അപ്പോൾ നമുക്ക് എന്തായാലും ഇതൊന്ന് നോക്കാം. Yes. So the patient is there inside the emergency room. So if you are taking it as a known case, if you are taking it as if you are, so mostly you can go for taking it as a known case because that enriches your confidence. That is what I tell you. So other way also you can go if you are more confident and if you are if you feel like you could handle that in an unknown way, you can go for that. In midst you can collect their identity, their name and all. Okay. അപ്പോൾ നിങ്ങൾക്ക് കോൺഫിഡൻ്റ് ആണെങ്കിൽ അങ്ങനെയും പോകാം, ഇല്ല വെച്ചാൽ നമുക്ക് നെയിം കളക്ട് ചെയ്തിട്ട് എമർജൻസി സിറ്റുവേഷൻ ആയിട്ട് തന്നെ ഇതിനെ മുമ്പോട്ട് കൊണ്ടുപോകാൻ പറ്റും. ഓക്കെ, സോ ലെറ്റ് us start. All are ready? So once in a while my friend Jobin will be displaying this question. Okay, so how we can start how can we go for a pleasant or an exact fitting introduction for this? So suppose we can collect the name like Martin. We have appraised the question. If the patient's name is Martin, now let us see how we are starting the conversation. So how we can start? Imagine yourself as a nurse. Okay, imagine yourself as a nurse and see how we can go for an introduction. Yes, can anyone give me a suggestion? Yes. So in this, imagine that the patient is there inside, we are going to deal with the patient. So we have got his name, we are going to deal with the patient in such a manner. Yes, Mr. Martin, are you all right? So that is an introduction that we can give to the patient. So inside he is under our observation, we are going to start. Yes, Mr. Martin, are you all right? Look at me. Yes, Mr. Martin, are you all right? Look at me. So they will be saying something like, yes, I can hear you. Can you tell me where you are? Can you tell me where you are? So he will be saying like, I feel like I am in hospital. Okay. Yes, you are in hospital now. So I am your attending nurse. My name is Abhilash. I will be your nurse. I'll be your attending nurse. Okay. I'm the nurse taking care of you. I'll be the nurse working with you. So you are in hospital. Are you okay? Can you tell me what is actually? Can you just express me the discomforts that you're having? So this is the way you can start the conversation. Yes, Mr. Martin, are you all right? Yes, Mr. Martin, are you all right? Look at me. Look at me. Can you tell me where you are? Can you tell me where you are? So they will be saying like, yes, nurse, I feel like I'm in hospital. Yes, you are in hospital. I'm the working nurse. I'm the working nurse. I'll be here taking care of you. Okay, so tell me what are all the discomforts you're having. Okay, tell me what are all the discomforts you're having. Okay, can you tell me what is going on at the moment? Okay, can you tell me what is going on at the moment? So they will be saying like, we had met with an accident, nurse. They will be telling you. Okay. Yes, I know, I'm sorry. I know that you've met with an accident. Can you tell me more about, can you please brief me what has actually happened? Yes, I'm sorry. I've come to know that you've met with an accident. I'm sorry. Okay, I'm sorry for that. Okay, I'm sorry. I'm sorry to hear that. Okay, you can say like, I'm afraid. I have heard that you have met with an accident. Can you please brief me what has actually happened? Can you please explain me how did it happen? Okay, how did the accident occur? So we are asking more about the accident. Yes, I'm sorry. I have come to know that you have met with an accident. I'm sorry. Can you please brief me what has actually happened? Okay, can you explain me how did it happen? How did the accident occur? So they will be giving you explanations like, oh nurse, I was driving. Okay, so they will be me and my friends were traveling in a car. We had an accident in midst. Okay, it was a head-on collision. Okay, who was driving the car? Who was on the driving seat? Who was driving the car? Okay, so he will be saying like, yes. Mr. Martin, if you don't mind, can you please tell me whether you had alcohol or not? You had a little alcohol or not before driving? Yes, we are going to assess. Okay, if you don't mind, could you please tell me? Okay, if you don't mind, could you tell me whether you had a little alcohol before your drive? Okay, whether you had a drink before your drive. You can ask like that. Okay, in a polite manner. Okay. So what about your friends? How many of you were there? Okay, could you tell me? Okay, could you tell me about your friends? Can you tell me about your friends? How many of you were there? Okay, could you tell me about your friends? Can you tell me about your friends? Can you tell me about your friends? How many of you were there? Okay, could you tell me about your friends? Can you tell me about your friends? How many of you were there? Okay, could you tell me about your friends? Can you tell me about your friends? How many of you were there? Okay, could you tell me about your friends? Can you tell me about your friends? How many of you were there? Okay, could you tell me about your friends? Can you tell me about your friends? How many of you were there? Okay, could you tell me about your friends? Can you tell me about your friends? How many of you were there? Okay, could you tell me about your friends? Can you tell me about your friends? How many of you were there? Okay, could you tell me about your friends? Can you tell me about your friends? How many of you were there? Okay, could you tell me about your friends? Can you tell me about your friends? How many of you were there? Okay, could you tell me about your friends? Can you tell me about your friends? How many of you were there? Okay, could you tell me about So they will be giving you a detailed description of that accident. Okay, and suddenly he will be asking regarding, oh no, nurse, where are my friends? I want to see them. Please ask them to come here. I want to see my friends. Okay, I could only remember their cry. I've noticed a shrill cry from my friends. It was head-on collision. Okay, I still can hear that cry. It is still, I could hear their cry in my ears. Okay, I could hear that. So please tell me where are my friends. I want to see them. Okay, so we have to politely decline that thing. Okay, we need to politely answer to the question. Okay, so it is given like we have no information about the other passengers in the car. Most important thing now is vital signs to be checked and comfortable while waiting to see a doctor. Okay, so we have to see that I understand. I understand. Martin, I understand. I know you are really down in downs. I know you are really down in downs. It is very hard to be in your situation. It is very hard, or it is very difficult to be there in your position, your situation. I'm sorry, we don't have any information of your friends or your co-passengers, I'm afraid. So politely we are saying, I understand, like I can understand. I know it is very hard to be in your position. I know it is very hard to be in your position. It is very difficult to be in your position. I know you are eagerly waiting for your friends. You are searching for your friends. But I'm sorry. We don't have any information of your co-passengers, of your friends or your friends. We don't have any information so far about your friends. Now it's our priority to deal with you. Now it's our priority to deal with you. You are my patient, you are our patient. Our priority is to deal with you. We have to see your health. Okay, we want to make you stable. Okay, now your health is here at utmost priority. We want to make you healthy and fit. Okay, we need to run certain investigations, examinations before the doctor comes. Soon the doctor will be attending you. Before that, it is a must to get assessed. Okay, it is a must to get assessed all your vital signs and your basic health checks. Okay, so before the doctor comes, it is our duty to finish the vital signs on and all other daily checks, so that we could start further management as early as possible. We could suspect some sort of fractures and head injuries. Okay, concussion. We could suspect some fractures and concussion, head injuries, but it's not. I think it's not quite serious. I feel like it's not quite serious, but we need to monitor your health status. We need to see what has actually happened. We need to assess the extent of wound, and we need to see how your health situation is. So before the doctor comes, it is a must to finish all your vital signs and other daily checks. So please do cooperate with us, and I assure you, we'll try to get more information as early as possible regarding your friends. But I assure you, we'll get more information on your friends as early as possible. So please relax and cooperate with us. Okay, so please relax and cooperate with us. Okay, so it is a must to get your health safe. So please do join your hands with us. That is how we are going to get convinced. We are going to convince the patient. I hope all my students are getting me what I'm saying. Okay, so soon the doctors will be attending you. So before that, it is a must to get all your vital signs checked and all other investigations done. Okay, so that we could start further management without losing any time. Okay, and I assure you, we'll try to get more information on your friends as early as possible. I'll make necessary arrangements to collect more information on your friends. Even we have got other patients in the casualty, I'll search among them whether your friends are there or not. I will search among them whether your friends are there or not. Trust me, and please join your hands with us for treatment now. Now your health is at utmost priority. That is how we need to convince the patient. So they will be asking like, yes, nurse, I'm getting you all those things, but just get me, even if I don't go for my, cannot go for my friends, get me my mobile phone. I want to make a call to them so that I could be able to know whether they are safe or not. Please get me my mobile phone, nurse. So what we can say like, I'm extremely sorry. Once again, I'm extremely sorry, Mr. Martin. We cannot allow you to go for, we cannot allow you to use your mobile phone. It is our hospital procedure and policy, as I have told you. So it's missing. Before that, the phone is missing. Actually, the hint is given there. Before that, we can just make them aware, like, I'm extremely sorry once again, Mr. Martin. We cannot allow you to make a call because it is against our hospital procedure and policies. Okay. So our patient's health is our priority. We always respect our patients. We always value our patient's health. Now it is our priority to make you safe. Now it's our priority. Now it's our priority to make you safe and healthy. We need to start the treatment as early as possible. We don't have any time to lose. We need to start the treatment as early as possible. Doctors are here. We'll soon start the procedures. We will soon start the treatment. And unfortunately, your phone is missing, so I cannot let you make a call. I'm afraid. I'm sorry. I'm afraid in the sense I'm sorry. Okay, I'm afraid. Okay. So, but I assure you, as I have told you before, I will definitely find more information on you. I will definitely try to fetch more information on your friends. But as I have told you, I will try to fetch more information. Okay, I'll try to fetch more information on your friends. Please trust me. Now, please stay focused on your health. Okay, now please focus on your health. Please join your hands with us. Okay, please cooperate with us. You can use any of those terms. So, we have just politely declined their request. Yes. Both those things, hospital procedure and policy, we have explained, and also unfortunately the phone is missing, so I cannot let you to make a call. That is what we have explained so far. I hope it is clear so far, my dear students. Yes? Okay. Okay. So then the patient will be okay, so they will be asking, like, what is the day, nurse? Okay, what is the time now? What is the day it is? Okay, so we can say, like, Mr. Martin. Okay, Martin, now it's today is Saturday. Mr. Martin, today is Saturday and it is almost midnight. Today is Saturday and it is almost midnight. So we are explaining them what happened while you were searching for time and day. Okay, what happened while you are searching for time and day? Oh, nurse, now it's soon it will be Sunday morning, no, nurse, so that I could go to a chapel. I could have you got a chapel here, nurse? Have you got a chapel here nearby, nurse? They will be asking you. So I want to go for my prayers, my routine prayers. I need to go to a chapel and pray for my friends. Please make necessary arrangement for my shift towards the chapel. I need to go there and pray for them. Okay. So what we can say, like, I value your feels. I value your feels. Okay. I respect your thoughts, or I value your feels. I know you are highly concerned of your friends. I value that. Okay. I really appreciate your concern on your friends. You are a true friend. They are blessed to have a friend like you. All those things, if you want, if you have got enough time, you can crack all those sentences like that, so that it will be more attractive. Okay. I value your feels. I respect your concern. I value your thoughts on your friends. But I would like to tell you that now it's not time for you to go to a chapel. Now it's not right time to go to a chapel. Now it's not right time to go for, now it's high time to go for treatment. You can say like that. I value your feels. I know you are highly concerned of your friends. They are truly blessed to have a friend like you, Martin. I appreciate that. But now it's high time to get the treatment done. As you know, you have just come across an accident. You are suffering from some fractures and other injuries. Okay, now it's high time to get it treated well. Okay, now we need to focus on your health. Okay, once you become all right, we will definitely make an arrangement. Okay, I could definitely make an arrangement for you to get shifted to a chapel. I could definitely arrange a visit. Okay, I could definitely arrange a visit of yours to the chapel. Okay, okay, once you become stable, I could definitely allow you to go to a chapel, or even if you want, means once you become stable, I can arrange a chaplain to come to you, a priest or chaplain to come to you. Okay, so now it's high time to get the treatment. Okay, now it's high time to get treated. you're suffering from, you come across an accident, now you're suffering from many injuries, there are some suspected fractures, okay, now it's high time to get it treated. Okay, but for your prayers and chapel, I understand, I know it's quite overwhelming, I understand, but I assure you I could make some necessary arrangements once you become stable. Okay, once you become stable, I could definitely arrange your visit to a chapel, or even I can arrange a chaplain to come and visit you so that he can have your prayers. So please try to understand the situation, focus on your health, okay, and please stay with us. Okay, we are working for you. We are working hard for you. Even you can say that. We are working hard for you. Okay. So, be sympathetic and firm. Firmly we are answering to the question, as well as we are using some sympathetic phrases. So, I hope it's clear, all my dear friends. Okay. So, well, what do you say? Are you ready to get the treatment done? Are you ready to cooperate with us? Are you ready to join your hands with us? Are you ready to join in the treatment process? Shall I continue with my treatment? Shall I continue with the treatment procedures? Shall I go on with, can I continue with my daily checks and assessments? What do you say now, nurse? Okay, so everybody, okay, nurse, then I'm ready. You can definitely, okay, so you are just not allowing me to do anything. You are not giving any information on my friends. You are not giving any information. You are not even allowing me to a chapel. Okay, as you wish, you please continue. Okay, you please wish, as you wish, you please continue. So we can say like, glad that you agree, Martin. Glad that you agree, Martin. I know it's quite disappointing. I know it's quite disappointing. But we cannot help you in any other way. But we cannot help you in any other way. Please stay positive, be optimistic. Okay, I hope your friends are safe, and soon I will be able to get some good news for you on your friends. Okay, let's hope that all your friends are safe, and I hope I'll be able to soon, I hope I will be able to provide you some good news on your friends. So that is what, okay, glad to hear that. So when the patient reluctantly agrees to our statement, we can say like, glad that you agree, glad that you agree, Martin. I know it's quite disappointing, but we cannot help you in any other way. Now your health is at utmost priority. Now we focus on your health, and be optimistic, stay positive. Okay, always see the brighter side. Okay, keep your spirits high. All those things you can say. Stay positive, be optimistic. Okay, I hope all your friends are safe. Okay, let's expect. Okay, I feel, I hope all your friends are safe. Let's hope all your friends are safe. Okay, let's hope all your friends are safe. And I hope I will be able to, let's hope all your friends are safe. And I feel I will be able to get you some good news on your friends soon. Stay positive, be confident. All those things we can say. Okay, shall I move on with my daily checks? Shall I move on with my daily checks? Are you ready? Are you okay? So all these things we are trying to convince the patient. Okay, nurse, you continue. Thank you for your patient listening and understanding, Martin. Thank you for your patient listening and understanding, Martin. Now you feel comfortable, relax. Okay, now you feel comfortable, relax. Let me start. Okay, now you feel comfortable, relax. Let me start. Okay, or you can say like, I'll be here around. Let me start. Okay, so now you feel, okay, thank you for your patient listening and understanding. Now you relax, feel comfortable. Let me start. Let me start. That means we are going to carry out the investigations and examinations, the assessments. That is what the topic is. Hope the question is clear to one and all. Any doubts or queries or concerns, means please tell me, please. Okay, hope the session was clear to one and all. So please make use of these sessions. So if you are taking it as an unknown case, okay, we can say like, before collecting the name, we can say like, yes, how are you feeling now? Look at me. Instead of collecting name, we are starting it as in an unknown manner. If you want to take this, means, yes, how are you feeling now? Are you okay? Are you comfortable? Look at me. Can you tell me where you are now? So they will be saying like, I'm in hospital. Yes, you are in hospital now. My name is Abhilash. I'll be the working nurse. Okay, I'll be taking care of you. I'll be working with you. I'm the nurse. You are in hospital. You are safe. Please feel comfortable. Please relax. Please feel comfortable. Can you tell me what has actually happened? Would you be able to gather some, would you be able to recollect what has actually happened? Can you tell me your name? So likewise you can take it as an unknown case. Okay. So will you be able to tell me your name? Will you be able to tell me your name? They will be saying like, I'm Martin. Well, great, Mr. Martin, you're remembering your name. Can you tell me where you are now? Okay. Would you be able to recollect what has actually happened? Can you please narrate me the situation? So likewise you can take it in an unknown manner too. So hope the question is clear to one and all. So please stay tuned for this upcoming sessions. You will be having some sort of interesting role plays. Many of our students are sending me queries, questions to discuss in upcoming classes. So thank you all for your cooperation. Thank you all for your support. So please do refer this. Please do listen to this classes. Suggest it among your friends. Those who are in need, please do suggest it among your friends. You can definitely make use of all these sessions. Okay, and get me my feedback. Get me your feedbacks. So we always welcome your suggestions and your comments, your suggestions and all your advices. Okay, hope you all have enjoyed this session. Stay tuned. We will be coming to you with another interesting sessions by next. Okay, see you again on next Tuesday. Till then, take care. Bye. God bless you all.